Casting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
All right, 27 minutes before 10 o'clock. Thank you for tuning in. Nice looking Wednesday morning. This morning there was a story in the news about a science story regarding the identification, I guess, of the gene that might be responsible for Alzheimer's. And it's over my head, but the bottom line is it sounds like those people we entrust with this kind of knowledge might have a cure for that one day. We hear all kinds of stories lately about, very hopeful stories and regarding cancer, etc. We have one right now we want to talk to you about Parkinson's disease. Dr. Jerry Vitik is on the phone. He's a professor and the chair of the Department of Neurology at the University of Minnesota Medical School, and he's got information about a new breakthrough in controlling the symptoms of Parkinson's disease. April is, by the way, Parkinson's Disease Awareness Month. Dr. Vitik, good morning, sir.
Good morning, Larry.
It's an honor to have you on our show.
My pleasure.
So are we coming close to a way? I was watching something on Parkinson's just the other day, and it sounds like at least we can control it. Is that what we're talking about here?
Well, we're talking about controlling the symptoms, yes, improving the symptoms, for sure.
And is it based on new discoveries?
Well, in part. I mean, we've had deep brain stimulation is what we're talking about, and we've had this technology around for probably about 20 years or more. But there's new technology that's been developed, and I think that's going to help us. And
is it in the form of pharmaceuticals? Is it a medicine?
No, it's like electrical stimulation deep in the brain and structures that cause the movement problems in Parkinson's.
Oh, my gosh. Wow.
So it's called deep brain stimulation. It's like a pacemaker for the brain.
Wow. And would the patient have to actually wear something like a pacemaker?
They would. They'd have a small battery pack that's placed under the skin, under the clavicle. It's all contained, connected by a little wire that goes up and then connects to a lead that's implanted deep in the brain.
Does Parkinson's cause other conditions? And if so, would this help those other conditions?
Well, with Parkinson's disease, it's a progressive degenerative disorder where patients have really movement problems, tremor, slowness, stiffness, gait and balance problems. Medication works pretty well for a while, but then it doesn't work so well as time goes on. And this is where we start looking at deep brain stimulation to regain control of those symptoms and improve patients' quality of life.
Wow. It's going to be fascinating to see how this unfolds. I mean, you never know what would be next. If maybe deep brain stimulation would, lead to another discovery. Do you have any hopes for something else?
Well, I do. I mean, I think deep brain stimulation has a lot of potential for a lot of different disorders. And I think part of the benefit here is that the new technology coming out gives us even more avenues in which to explore other disorders and diseases. The technology that I'm talking about now is something that just came out in December of 2017. This is a Vercise system. It's a DBS system that was developed by Boston Scientific. It's based off a cochlear stimulation platform, and it allows us to give really precise amounts of current delivery, and it's very adaptable.
Wow.
Small battery, rechargeable for 15 years. These are all things that, make our life a lot easier as physicians and can vastly improve the ability of us to make, great gains, I think, in how we treat these patients. So Parkinson's patients can do quite well with DBS.
Can you tell us a story about somebody with Parkinson's that is using this, or is it too early to do that?
Oh, no, not at all. I mean, since, the study included well over 190 patients, but the FDA approval came in December, and we did our first patient after FDA approval in December.
Okay.
That patient's doing extraordinarily well. So patients, for example, that have a lot of trouble with just activities of daily living, getting dressed, cutting their food, getting up in the morning, brushing their teeth, combing their hair, etc. Those are things that you and I take for granted.
Yeah.
They can't, because it can be very difficult. Their medication may be working, and then all of a sudden it quits working, and they don't know when that's going to happen.
Right.
But with deep brain stimulation, we can really bring all that under control for a significant number of years.
Wow.
And I think that's a major breakthrough for
that is
people.
Exciting. And does the device itself, is it inconspicuous? Is it how big is it?
Yeah, it is. Well, I mean, you can't see the device. Everything's under the skin, so the lead is placed in the brain.
Wow.
It's secured on the skull. It's under the skin. Again, pretty much like a cardiac pacemaker, except that wire, instead of going in the heart, goes into the brain.
Wow.
We've had patients skiing. We've had patients downhill skiing, water skiing. I'm not saying everybody's going to get that benefit, Larry, but the fact is that this is really a great technology, and frankly, the new technology that's coming out is really giving us some major advantages.
Now, usually we hear about Parkinson's with older people. The other day we had a lady on, and she was a young mom. I don't know how old she was. She probably wasn't even 30, but let's just say she was in that ballpark. Would this... I don't even know if it's too early to ask this one or not, but would this technique, the deep brain stimulation, work differently for somebody who's younger, simply because they're younger?
No, I think, in fact, it might work better.
Yeah.
If you look at age-related problems, when people get older, there's other things besides Parkinson's that kind of get in the way. But we look at people's general health. We've done patients that are even in their 80s, if they're good biologic health.
Yeah.
We've also done some very young patients.
Wow, this is really fascinating. Can you help us, as in a layperson's language, understand what exactly happens?
Well, in Parkinson's disease, we lose dopamine. So there's cells deep in your brain that make dopamine, and those cells, they send projections to other parts of the brain, and they kind of keep it under control. When you make a movement, it's very precise. The action of your muscles, which muscles get activated, which ones don't, in what order. It's like playing an orchestra in some ways.
Yeah.
In Parkinson's disease, that all goes awry. So those brain signals just aren't working well anymore. They're kind of out of a rhythm, so to speak. Things don't happen when they should. The pacemaker, the deep brain stimulation, and particularly the Vercise system right now, allows us to kind of regulate those brain rhythms in a different fashion. And because of the precision and the flexibility we have with the new technology, I think it's going to give us even better options for doing that. And exploring, frankly, other applications down the road, not just Parkinson's. Yeah,
I can see that too. So if in my mind, and again, I'm a radio guy, so I'm trying to visualize it, I guess. If I imagine like a miniature masseuse inside my brain, like using her hands, whatever, to push back and forth, is that sort of what happens, except it happens with electricity?
Yeah, if you think about putting electricity, let's say you want to put electricity into a bunch of cells that are just doing their own thing, and you pass that electrical current out, it kind of brings them together, and it tells systems that it projects to, you guys need to come under control. And it kind of normalizes things, is what we think it does. We've done a lot of studies on this. We have good evidence suggesting that indeed that's what it does.
Wow.
I think you can get pictures. I can give you a couple of websites that patients can go to and look at.
Yeah, thank you.
And that will give you kind of visualization what it looks like.
Okay.
One of those is called dbsandme.com. And that's a resource from Boston Scientific, who I'm working with today.
Okay.
And you can also go to the University of Minnesota DBS website. And we're Udall Parkinson's Disease Center of Excellence. So that website is Udall, udall.umn.edu. It really is, I think for a lot of patients, they hear deep brain stimulation and they might get nervous about it. But really, the risk is relatively small and the gains are relatively great.
I can't tell you how much we, as the general public, appreciate the work you do. It's just fascinating that anybody would even think of this as a way to solve this problem. So thank you for what you have dedicated your life to doing, Doctor.
Well, thank you. I couldn't be happier doing this work. Nothing else I'd rather do.
I want to let the listeners know that we do record these interviews, and I will put this up as a podcast later on, so that the websites that the doctor mentioned, you can go back and listen to them again, and that way you will have them. A lot of the times listeners are driving or riding in the car or whatever. It's kind of hard to write things down. Dr. Jerry Vitik, thank you for being on the show with us today, and congratulations on such amazing work.
Thank you, Larry.
That was really cool. All right, we will take a little break. We'll be right back.
Are you or someone you know looking for a new career in healthcare? Is the cost of training preventing you from taking that next step? Palm Garden of Ocala can help. We will pay all tuition and exam fees, plus a bonus to you on completion of the class and another bonus on completion of a successful orientation. For more information, stop by Palm Garden or call 352-854-6262. That's 854-6262.
Are you looking for some spring color? Look no further than Bob Wine's Camellia Gardens in Ocala. For African violets, just $3.99.